Good evening again, and welcome to tonight's town hall meeting regarding vaccines. Although we have a smattering of people here, I'm glad that I've been here since 5 and just have seen the steady flow of people just 2 doors down getting vaccinated. And that's what the purpose of this is tonight, is to get people vaccinated. And so we wanted to take this opportunity at least to impress upon the public how important this is as a county, as a community, to make sure that we get people back in our communities and out and healthy, and hopefully can get to what this new sense of normal will be. But that's incumbent upon each and every one of us getting vaccinated. And so I hope that you can do your part. So many of us here have done our parts and we're able to be without masks, which is why you see some of us maskless. And I'm hoping my family do their part, as I brought my son here about an hour ago to get vaccinated as well, and want to encourage the public to bring their young ones out, as vaccinations are now open to those 12 and above. So encourage you to take advantage of that opportunity. With that, we are pleased to have an esteemed panel here tonight, which will be introduced by Dr. Memark of Cobb Douglas Public Health. And Dr. Memark is our director of Cobb Douglas Public Health and has been with us this entire way through the pandemic to make sure we stay on top of information and that we have gotten people tested and vaccinated. So just appreciate all that you've done for us, and I'm going to turn things over to you.
Right. Thank you, Chairwoman. Thank you, our dedicated crowd that is here with us today. I'm really excited to be here and be here with some of my most esteemed colleagues from our medical community. I'm going to give you a quick update because you know it's my favorite thing to do is let everybody know the state of COVID in the county. And today you're really lucky that we passed a mile marker today. And so does anybody know what that is? We went below 100 today. So that is a really big deal, and the reason why it is because 100 per 100,000 is considered high community transmission. This is the first time we've dipped below that since October. I think it was October of last year when we did it for like 6 hours, and that was probably about it. And so it's a huge blessing. And on top of that, we have our positivity rate is at 3%. So 3% of tests are coming back positive. At our height, we were above 25%. Every 1 in 4 tests that were taken were positive in our community. And so we've come a long way. Hospitalizations are holding steady, lower steady, but they're actually steady though. So we continue to have people that continue to be hospitalized for COVID right now. And throughout the nation, what we are seeing is younger folks that are being hospitalized. And our deaths keep trickling in as well. Does anybody know maybe the reason why our hospitalizations are fairly low, but continue to come in? And younger folks. So guess who the folks that did their best at getting vaccinated? It's our older folks that got vaccinated, and they were the ones that were dying at astronomical rates, right? And so we were able to stem that, but we still have people that are still being hospitalized and are still dying, and so we still have a battle to go here. So in Georgia, we're at 31% for vaccination. In Cobb, we're 33, and we're 41% that have the first vaccine. So that's pretty good. So in the nation, we're looking at about 50. So with even that amount, we're doing pretty well. But I'm still concerned, though. We've heard yesterday in a call that our variant numbers for B117, which is the UK variant, is now over 76%. Of all the specimens that are being put in, 76% are on the highly contagious B117 variant. What is concerning to me about that is that we have a group of folks that are mingling now and are not vaccinated. And so if we let this variant continue to kind of have breeding grounds, that it can spawn off another variant, and one that could possibly be resistant to vaccines. We have been really blessed to this point that we have not had a vaccine resistant mutant yet. But You know, it's almost like you're kind of testing things. That's why it's so important for us to get as many folks vaccinated as we can, because if you let one group go ahead and transmit the virus back and forth, then you can get something dangerous coming out. So we're going to talk a little bit more about the vaccine today, and I hope that everybody that's here will be able to share some of this information with your friends and family. We know we have 59% of folks that don't want to get vaccinated or haven't gotten vaccinated, so we need to try to spread the word as best we can. So I'm going to begin by introducing our panelists. I'm going to begin with Dr. Hines, Jeffrey Hines. He's a native New York. He went to Brown University in Providence, Rhode Island, and he was in the 7-year combined program for medicine. So, and that's, for those of you who don't know, is very, very hard to get into. He is the medical director of diversity inclusion and Center for Health Equity at the Wellstar Health System. So very important. He's looking at vulnerable populations, and he works with our team a whole lot and with Cobb County for us to do a lot of work together. He's the chief of the Division of Gynecology Oncology for the Wellstar Medical Group as well. And he's a diplomat of the American Board of Obstetrics and Gynecology. And he's done a whole lot of publications and research as well. So welcome to Dr. Hines. And thank you. Next, we have Dr. Andrew Doyle. He is a general pediatrician with the Wellstar Health System for the last 3 years. So he sees patients daily, and he's a vaccine coordinator for Wellstar Pediatrics. And so before coming to Wellstar, he was actually in the U.S. Army for 20 years, working as a general pediatrician as well, yes. Dr. Hines was also Army too, Dr. Hines? Yes, also. So are you both colonels? Is that what you were saying? Yeah, huh? Lieutenant Colonel and Colonel. So we got some high-powered folks here. He had multiple leadership positions while he was in the Army hospital as well. He went to George Washington University for his undergraduate medical degrees, and went to San Antonio, Texas for his residency. He's a board-certified general pediatrician, and he was a past president of the Uniformed Services section of the American Academy of Pediatrics. So welcome, Dr. Doyle. Thank you. Dr. Paula Graves she's a native of the Republic of Panama, and she represents our women's health division, if you have any questions for her. She was appointed the first Hispanic service line leader in 2019 at Wellstar, so she is always breaking barriers. She was also chief women's health officer as well, and for 24 years she's been working at Wellstar with numerous leadership positions, including chief women's health officer, the EPIC champion. She's practice director, department chair, med exec committee member as well, and she's on our board for Cobb and Douglas Public Health. She's a big, I knew Dr. Graves before I came to Cobb and Douglas, and she's a big supporter of vulnerable populations as well, and she takes care of lots of the mommies and babies that have nowhere else to go when they need to have care for themselves. So thank you, Dr. Graves, for being with us. All right, so I'm going to turn it over to Ross, and he will help to moderate and go through, and then we can ask some questions if you all have any questions that you would like to ask. Thank you.
Thank you, Dr. Memark. Hi, I'm Ross Cavett, Cobb County's Communications Director. I have a bunch of questions to ask, and Dr. Memark, if you can grab the mic, because I'm going to send the first one your way. And I've got a lot of questions from people ahead of time, and we may have some in the audience here, but we have a lot of information to go over. And I'm going to start, before I hit the law firm of Hines, Doyle, and Graves. First of all, I want to ask you, Dr. Memark, you said we're now below 100 per 100,000. Which is good news, but I know there's going to be people out there saying, okay, we've passed that milestone, so obviously I don't need to get a vaccination. What would you say to them?
Oh, that's a great question, Ross. So, yeah, so we're very lucky that we've gone below 100, right? So, but we're still in a precarious situation though. So at the same time, we're lifting many restrictions, and I've talked to a couple of folks about that as well. So for example, we have Braves and Atlanta United games with 40,000 people in attendance that are not social distancing, right? So we have this is a breeding ground. We definitely need to make sure that we're all protected, because like I said, they can continue to pass it amongst each other. When you look at these stats for who's vaccinated, when you look at our 20 20 to 24, 25 to 34-year-olds, it's only about 33% vaccinated. All right, so we have 67% of very social people that are out there that are not vaccinated. So that's why we need to make sure everybody is vaccinated. And we still have children that can't get vaccinated. And we do have one that's in the hospital with the multi-inflammatory syndrome right now. So this is a very real pandemic that we continue to fight against.
Thank you. And I have, again, a bunch of questions here, but I'm going to start with some that I hear from my own family. Always good to stay close to home. And any of the doctors can answer this, but Dr. Hines, you're closest to the microphone.
Thank you, Ross.
You know, my family members say, this has happened so fast. These vaccinations came out so fast. There's no way they could be properly vetted or ready at this point. How would you respond to that?
Thank you for that question, and thank you everyone for being here, and thank you for everyone being vaccinated. What's important about that question is to first acknowledge that people do have that question, and it's a legitimate question that we need to spend some time answering. So I won't take too long, but the technology for the vaccines, or the platforms that people talk about, the mRNA vaccines, the vector vaccines, those vaccine platforms have been out for literally a couple of decades. So the experience in using the delivery mechanism into your muscle has been out there. So that's been vetted. When this pandemic hit last year around this time, people were dying. And so there was a lot of emphasis, a lot of money and infrastructure put in to get these vaccines to market. But things like safety were not put aside. These are safe vaccines. The trials that have been done in more than 120,000 people between the Moderna, the Pfizer-BioNTech, the J&J, and some other ones that haven't yet come to market were fully vetted. They are safe and they are effective. And what we're seeing now in May of 2021, the real world experience that these vaccines are safe. We're seeing that people don't get hospitalized compared to folks that aren't vaccinated. We're seeing that people do not die when they get vaccinated. So if you take 120,000 people that underwent these clinical trials, and now we have, I think the number is 284 million doses have been put in people, we're seeing that still people are doing well. People are not dying. People are not getting infections. So safety was not foreshortened. These vaccines are safe. They are effective. I'm sure Paula will talk a little bit later on. Dr. Graves will talk a little bit about how they're safe in reproductive age group women, and there's data to support that. But they did not come out too quickly. The technology was there. There was emphasis to get them out. There was money that was put in place to get them out, but safety was not compromised at all.
Thank you, Doctor. And I'll continue with those from my family and those I know, and either Dr. Doyle or Dr. Graves can answer this one, but you know, we've heard of problems with blood clots in certain people, and we've heard of some heart issues in the younger people. So that may be a concern to me if I want to go out and get a vaccine. How serious are those issues? And if I'm thinking or still on the fence, how much should I think about them when it comes to getting a vaccine?
Thanks. So speaking, as a pediatrician, I can really address the heart issues with the younger ones. There have been a few, and that's literally a few, reported cases of some of inflammation of the heart, may be related to the vaccines. We don't know if that's really there. That's just being investigated right now, but we should acknowledge that it's out there, that it has been in the press, and it has happened, and all of the health agencies, CDC, and everybody are investigating that right now to try and figure out what happened, if it is related, or more likely, perhaps, just is something that happened among those who happened to get the vaccine but are not related, because there are many things that can cause that besides the vaccine that we see every year, including viruses that are active this time of year. So is it related to the vaccine, or is it related to something else? That's what they're looking into. But I want to repeat, it's very, very few, like less than a handful of them that are being investigated. But that also shows the dedication to safety that the health community takes with these, that when something, with these vaccines, when something does come up that is perhaps unexpected, we immediately go back and they're looking at the safety of the vaccines to see how it's related. But I would also say, as we know that, speaking of heart complications, that in younger children, especially adolescents, that the COVID vaccine itself is known to cause significant, can cause some significant heart complications in adolescents and others, so that the virus itself is probably more dangerous and something to be more concerned about than the vaccine that is so far has been shown to be very safe, and unclear if there's anything related going on in terms of the heart disease. The virus is known to be dangerous. The vaccine so far has been consistently shown to be safe. So it's much better to get the vaccine than to get the virus.
And I'd like to pass it to Dr. Graves, and along the same lines, how much do you hear those concerns coming from people out there, and how much of your time is spent dispelling or explaining some of those concerns?
Well, Dr. Google, unfortunately, has become the latest infectious disease. He's competing against CDC. So we're constantly having to counsel our patients regarding rumors and misinformation that is out there. So I'll talk from my perspective from women's health. Number one, and it became worse because recently there was a pause on the J&J vaccine, and I'm grateful that it was just simply a pause, because there was a small number of women that developed blood clots after receiving the vaccine. And when we say small, as compared to millions that have received the vaccine, it was a very small handful of women. And after investigation, we have now, continued with administration of not only the Johnson & Johnson, but also AstraZeneca, which were the vaccines that blood clots seem to be an issue. So to your point, some of the questions, and these are very pertinent to women's health. So if you just give me a couple of minutes, I'm excited about women's health, so, Number one, pregnancy. So it has been known that COVID during pregnancy has a higher risk of having a severe illness than women who are not pregnant, or women who do not have COVID. COVID has, in pregnant women, there is an increased risk of preterm labor and birth. There's an increased risk of multiple hospitalizations, of being in the ICU, of being intubated, and unfortunately of even dying. And that used to be something that I quoted this same time last year, and unfortunately, in 1 year, I have seen it happen. So it does happen. So when we argue about COVID in pregnancy versus the vaccine in pregnancy, there is absolutely no doubt that this vaccine is life-saving in pregnancy. It is true that in the clinical trials, pregnant women were not included. However, there were many women who were in the clinical trials that went on to become pregnant. And those pregnancies were followed. They were healthy pregnancies and healthy babies. Now, so we know what COVID can cause in pregnancy. So now we know what the vaccine can do. The vaccine can not only prevent the disease, but the studies show that the antibodies that we develop to become immune against COVID, that those antibodies in the pregnant woman can pass to the fetus and convey protection to this very delicate human for many months after being born. That is not a new technology. Currently in pregnancy, the last trimester, we give a vaccine series called Tdap, so that we can protect the baby from developing pertussis during birth. So it is a concept that we've done before, that we've used before. Also, the antibodies do pass through breast milk. so that moms who receive the vaccine, either while pregnant or shortly after delivering, can also convey protection or immunity to babies through breast milk. So this is an amazing development in the midst of a pandemic, and that is why we need to encourage as many of our moms, pregnant moms, to obtain the vaccine. Also, another rumor, I don't know if you want to let me keep going, give me a microphone, but another rumor is the vaccine can cause infertility. That vaccine can cause infertility in men but especially in women. To date, I don't know of any vaccine, and we many studies have come up that will just automatically cause infertility in women. And of course, also the fact that now we have we have the real human trials now. How many have been vaccinated and it has not caused infertility? There was a rumor in Dr. Google stating that the antibody looked like part of the spike protein of COVID, and that it will attack the placental tissue or will attack cells, and the vaccine cannot enter our DNA and alter it. So we are constantly going against, fighting, almost like walking against the tide, convincing our patients to get the vaccine before getting pregnant. If they're pregnant, to go ahead and get the vaccine. After they deliver, it's not too late to get the vaccine to help their babies.
And this one, for anybody that wants to tackle this one, and Dr. Graves just touched on the next question, but it is, I have heard that one or all of the COVID vaccines can alter my DNA, and I don't want nobody messing with my DNA. So what would you say to those people?
So that's just not true. That's a myth, that's a misconception that we need to continue to bust. As mentioned, the vaccines do not enter your DNA. In fact, the genetic material that's introduced to your muscle cell actually doesn't live, if you will, very long. It's quickly destroyed after it does one of two things. It will make an immune response with antibodies or elicit cellular immunity, which are both protective against getting the actual coronavirus infection. But it does not enter your DNA. It makes this spike protein that Dr. Graves mentioned, which is what your body then says, this is not me, so I'm going to make antibodies or elicit a cellular immune response against it, so that when I do get exposed to the true virus, I can develop an immune response that'll protect me at first, not getting the infection, which is really good, but now we're finding more and more that it may help prevent transmission of disease. So not only is this a disease vaccine in as much as it prevents infection and it prevents death, there is a growing body of literature that would support that it prevents transmission. So it's a very effective vaccine that does not go into your DNA.
All right, I love how that you guys are just transitioning perfectly into the next question. And in this case, Dr. Hines, you just touched on it. Somebody said, I've heard one of my friends got the flu after getting the flu vaccine. I don't want to get COVID-19 after getting the COVID-19 vaccine. True or false, or possible?
So that also is false. So the first thing to address there is getting the flu vaccine does not give you the flu. So when you're given the flu vaccine, again, you're not given the flu virus. You're given, but your immune system is triggered. What's going on in that case, and it's very similar to what then happens with the COVID vaccine, is your immune system recognizes the vaccine and it starts to mount an immune response to the vaccine. So when you do see the flu for real, your immune system already recognizes it, already knows how to deal with it. When you have the flu, you mount an immune response to the flu. And what makes you feel bad when when you have the flu is your own immune system mounting its response. Your fever is your immune response reacting. You kind of feel a little muscle achy and stuff. So that same response is what you have when you have the flu vaccine. So it's actually when you get the flu vaccine, and if you feel like you had the flu for a day or two, that's probably a good thing. It's telling you that your immune system is working and is developing memory to fight the flu later on. The same thing happens with the COVID vaccine, with the side effects that we've heard about. We are not giving you COVID. We're not giving you in any way the virus. We're giving you something, a part of the, depending on which vaccine it is, we're giving you something to mount a response to the virus. Your immune system recognizes that I need to mount a response to this, so I'm going to mount a response to it, so I'm ready the next time if I ever see the virus. And it is that immune response of your own body that is going to make you feel, muscle ache and maybe a low-grade fever, for 24 hours maybe. But again, that's a good thing. You want to see that happen because it tells you your immune response is working.
I had no side effects. Now I feel kind of bad about it. And that dovetails in. Yeah, I volunteered to get my third shot, an early booster. So Dr. Graves, that actually is the next question on the list here. I've heard horror stories from my friends about side effects. Am I going to get side effects? How can I prevent myself from getting side effects? And how do I deal with any side effects that I get after the vaccination?
Most side effects are mild. And they include side effects that many of us have experienced from other vaccinations. The sore arm, a little bit of a low-grade temp, fatigue. Those are the milder ones. Some get, a little bit of a headache and stomach ache. One of the recommendations is some people will say after receiving the vaccine, a lot of hydration, plus or minus analgesics afterwards, if you have severe symptoms. So there's nothing to do. I think actually that is, I will say, a good sign. Not having side effects does that mean that the vaccine didn't work, but certainly to just let it run its course. If the side effects are severe to the point that just functioning with, after 24 hours of receiving the vaccine, if daily function is not possible, if severe muscle aches or just crippling side effects, definitely to consult the primary care provider.
And again, the next question's kind of dovetailing off that as well. I've already had COVID-19, so do I need to get vaccinated? Because I heard I was immune.
So that's a question. Actually, I've run into a lot of people that there's a significant confusion about that. So that I had COVID and so I'm protected, right? Well, I mean, the protection, you will have some protection, and the average is, thought to be about 90 days. Some people get more, but I've seen some people get less. And so your protection will wane. And we have lots of information that shows that. And so it is very important to be able to get the vaccine because then you can have further protection from that. Yes, sir?
Actually, I wanted to ask a question. For example, in my personal case, I had the disease a year ago. I just had my titers checked about 10 days ago, and they're still very high. So having high titers, why should I get the vaccine?
Well, not many people get the titers drawn, and so if your titers are very high, like you say, then you could probably hold off a little bit, but you also don't know when your titers are going to drop, right? And
I plan to check the titers again in 6 months.
And Dr. Mubarak,
6 months is a long time.
If you can explain what he asked.
Oh, I'm sorry.
For the viewers.
He said that he's able to get his titers checked, and he's checking them every 6 months because he had COVID about a year ago, and he has very high titers. Every
Which
6
means?
I'm sorry, antibody titers. So he has immunity that he has. I have spoken to somebody, one of our senators, that actually is part of the Emory study, and she got COVID, and her titers were high, and then what happened was after a few months, they started to go down. She got the first vaccine, which bumped the titers up a little bit, and then she got the second, and they sent them up sky high. So the problem, if you told me you were going to do it, every couple weeks, I would feel a little safer. But if you're doing it every 6 months, now that's a big window, and you could be 29 and have no medical problems, but you could be a little bit older, and that would make you susceptible, right? And so you could run into a problem. We have at least 4 of the mutant variants are circulating right now in our community. Why risk that? Open yourself up to that. You know what I mean? Because we have a vaccine that works against all of them. I hope that answers.
And do you know if the natural immunity works on all of them? I mean, it has been studied?
I don't know if it works against all of them or not, but we have people that have been infected again, right? And then we don't know how long your immunity will last. That's the main issue, is at what point is it going to start dropping off your natural immunity?
Yeah.
I would just be careful, sir, also about the type of antibodies that are being done. Certainly, if you're part of the clinical trial, they know exactly what type of antibodies. They're called neutralizing antibodies. And what that means is those are antibodies that actually go out and fight the coronavirus. There are other antibodies that are expressed by coronavirus that just say that you've been exposed. So I would just ask the lab that you're getting that done to make sure you have the protective type of antibodies as opposed to the antibodies that just say that you were exposed. The other thing that I will add about do you need to get the vaccine after you've been infected is that many of us who get, and I have not gotten it, which is very fortunate, but many people who do get coronavirus and don't have to get hospitalized can be treated at home as an outpatient. Sometimes they get, you may have heard, the monoclonal antibody therapy that's available to help decrease how long you're sick. If you got that as an outpatient, then you should not get vaccinated for 90 days. If you were hospitalized and you got convalescent sera as part of your therapy in the hospital, you should not get vaccinated for 90 days. But Dr. Memark is right on. Right now, the science tells us that vaccine-induced immunity lasts longer than natural-induced immunity.
That brings me to the next question, which is some of these vaccines, you got to get the 2 shots. J&J, you get the 1 shot. Why do some require 2, and how do I decide which one's the vaccine I should get?
So the easy answer on which vaccine you should get, I think the recommendation, and I would recommend, is you get the vaccine that's available to you. What you get because they are all effective. The differences between is it a 1 vaccine versus a 2 vaccine all come down to the way that the different ways that those vaccines deliver and the immunity to you and how they were studied. But in the end, the studies showed that when delivered in either the 1 shot or 2 shot, depending on the type of vaccine, they are all effective. So the answer is really easy. It's get the one that's available to you. For example, if you are a 14-year-old, the answer is easy. You should get the Pfizer vaccine because that's the only one that's available to you. If you are 35, you get the one that's available to you that you can get as quickly as you can.
And while the pediatrician has the microphone, why is only the Pfizer now available for those 12 and older? Why just that vaccine?
The Pfizer vaccine is the only one that's available to 12 and older because Pfizer closed their studies first in studying that age group and was able to produce enough data that then showed the world that that vaccine was both safe and effective in the age groups between 12 and 16. Moderna is just now closing their studies, so they will be going through the process to get approval also, but it's just that Pfizer did it first.
Dr. Graves, we've heard a lot about variants. Dr. Memark's been preaching to me about variants for how many? Okay, we'll be right back. Are all these vaccines, do they work against all these variants we've been talking about?
Yes. But this is so the thing about variants, and they are, we see them pop up at different locations in the United States. So once again, this is cause for promoting getting as many people vaccinated as possible, because the problem when we, don't have a high population of vaccination, it then allows for those variants, for more variants to pop up, and then we start the vicious cycle of, getting back into the lab to try to create vaccines that can cover these new variants. So, what I don't want us to do is paralysis by analysis, for us to stop and think about the possibility of what can happen. And while we are pausing to wonder, it happens. So the most important thing that we can do for our neighbors and for ourselves, and to decrease the possibility of more variants popping up, is to encourage more people to get vaccinated to prevent more variants from occurring.
Okay, thank you. And we've chased a microphone down. It's not working though, but we've got one. It looks good.
Is there any plan to vaccinate children younger than 12, and if so, till how young?
Yeah. The question is there's any plan to vaccinate children below the age of 12?
Yes, those studies are currently going on right now to look all the way down to 2 years old, I believe is where the studies are right now. And both Pfizer and Moderna, I know, have those studies active and are enrolled, and they anticipate, sometime in the fall closing out those studies and starting to evaluate the data and go through the process again of seeing if it's, safe and effective, and then going through the approval process. So yes, that's the plan, but they're just not there yet.
And Doctor, while you have the microphone, another question is, I'll kind of put two of them together. Why should I get my child vaccinated against COVID-19, and how can I be sure it's safe?
So again, it is safe. The studies have been shown. So again, right now it is approved. The Pfizer one is approved down to 12 years old. And that was just done a few weeks ago. That approval came out, and that those data were released that showed that came out of those studies that showed that it was as safe as all the other vaccine, as safe as it was for all the other age groups. It was equally safe for the 12 to 16-year-olds and as effective. So that data is out there and available, and they are safe. Why should they get it though? Which I think becomes the bigger issue. It's because children, adolescents are just as at risk for getting COVID as anybody else is, and they also can have, individually can have severe illness. They can be hospitalized. They can have prolonged symptoms, and they can die from the virus just as anybody else can. And they also can spread the virus to other vulnerable people. So they can bring it home to the house and spread it to grandma. They can bring it home to the house and spread it to the 4-year-old who is also susceptible to the disease and the consequences of it. So, for their own safety and for the safety of everyone around them, for the same reasons we ask everybody else to get vaccinated, is why we're asking, for the teenagers to get vaccinated, because it's available to them now.
And I've got a couple questions for Dr. Graves. I'm going to, again, for the sake of time, combine two into one. Believe it or not, Dr. Graves, I want to get pregnant. Should I wait because of COVID-19, or should I wait after getting the vaccine? And should I wait to get my breast cancer screening done as well because of the vaccine?
Well, that would be miraculous if you were able to get pregnant. However, I would not wait to, I would get the vaccine now at whatever stage I am in. In other words, not pregnant, get the vaccine. Pregnant, get the vaccine. had a baby, get the vaccine. So at all stages, it is definitely protective. So I think that answers, that was the first question. I want to get pregnant, when to get the vaccine. The second thing has to do with mammograms. So the Society for Breast Imaging noted a slight uptick in the number of lymph nodes in just screening mammograms during, this pandemic. And after a careful study, because, lymph nodes during mammograms, that finding is a very rare finding. And so it was found to be linked. It's a transient, by the way, temporary side effect that occurs with the vaccine. So what is the recommendation? And if a woman needs to get a mammogram, go ahead and get the mammogram if she has not gotten the vaccine yet. However, if you are getting the vaccine and there's no way to postpone anything, get the vaccine and wait 2 weeks after your second dose before getting the mammogram. So that's number one. 4 to 6 weeks. I said 2 weeks. 4 to 6 weeks after the second dose of the vaccine. To get the mammogram. So that's number one. But number two, also let the mammographer know which side the vaccine was given, okay? So that they can be aware. If they see it, oh, okay, it was on the left, and that's where, I got the vaccine. Number three, if the patient had breast cancer, then make sure that the vaccine is placed on the opposite side of the breast in which the breast cancer occurred. In other words, if the breast cancer was on the left breast, get the vaccines on the right. Okay, because the last thing that we want is when a mammogram or further imaging is done, that there's not more false alarm. Especially if there was a history of breast cancer. So just want to make sure that I didn't confuse anyone. If you're going to get a mammogram, wait 4 to 6 weeks from your second dose before getting the mammogram, and always notify the mammographer or the person who's bringing you in as to, hey, I got my vaccine and it was on the left arm and it was, X number of weeks or months ago.
I just have to, and that's awesome, but I have to say, I have to put my oncology hat on. You're talking about mammogram, that's a screening test. One of the things that we've seen over the past 12 to 15 months is people have put off their screening test because they've been afraid to go to imaging centers. Men have been afraid to go get their PSAs and their exams. And what we're seeing real time now is an increased incidence of cancers that are higher stage, and that's going to translate later on to people dying of disease. So please, people, it's not just mammograms. Make sure you get all of your screening tests done. Hospitals, imaging centers, they're all safe. We're becoming more and more vaccinated. Please get your imaging studies done.
And while you have the microphone still, you and I were on a lot of Zoom calls about this. I've heard that some ethnic groups are hit harder by COVID than others. Is that true? And if so, how do we combat that?
So one of the wonderful things that we have done over the past years, we have partnered with Cobb Douglas Public Health, with our city and county leadership to look at specific, what we call hotspots. Where are those areas where we're seeing more infections per capita than what you expect to see? And clearly, at first we saw them in nursing homes, and we addressed that. Then we started to see them in certain communities, especially people who are black and brown. And it's not necessarily that those people are more at risk for getting coronavirus, but the surrounding structures around them, what we call the social determinants of health. Things like, the housing that they may live in, whether they have the ability to stay at home and and not have to go to work because they're essential workers. Those are the reasons that put certain communities at higher risk. And one of the things that I'm very excited about, the partnership with Cobb Douglas and with Cobb County, is we were able to identify those hotspot areas. And last year at this time, when testing was an issue, we could deploy teams to go and test people. And now we're using that same infrastructure for those same communities that are at risk, where access is an issue. And Madam Chair Cupid preaches this all the time. We've got to get shots in the arms as close to where people are as possible. And we're doing that. We do the same hot spotting, looking for those areas where people need to get vaccines with our partners at Cobb Douglas, and we're sending teams out to vaccinate people.
Dr. Memark, the state average is below the national average. Cobb County is slightly above the national average. Why are we lagging here in Georgia, and how are we trying to change that?
So that's a great question. So Cobb County is still below the national average. We are above the Georgia average. And so, I think first of all, it's, there are different philosophies on things like vaccinations, and so we have work to do in educating folks. The other thing that we're really working hard on is access, and so a lot of people that were first able to get the vaccine, you probably remember, it shut down our entire health department. We couldn't even function. We had so many calls, and we had people showing up, lines around the streets. The people that were able to get vaccinated had, access to do that, right? They traveled different, hours to get vaccinated. Now we're trying to reach these populations that don't have as good access. So the people that have to work, they have no time off to work. To come to get vaccinated. They don't have time off if they get sick from the vaccine. And so we're trying to go and reach them and talk with them and get them vaccinated as well. So our team is, Jim Miller will be breaking apart soon in the next about month, but then we'll have more teams that are deployed to go out to vaccinate folks where they are. And so it's some ingrained misinformation that's out there that we bring an esteemed group here to try to talk to people and give them the answers they need.
And I want to check, anybody have any other questions out here?
Oh,
yes, we do.
Let me go up here first to get a question up here.
Got a working microphone?
Yes, we do.
Thank you so much, everyone, for being here. And I think you all rock. Thank you so much. I was talking to my sisters, and we all agreed that one of the big problems is that there is so much misinformation that a person doesn't know what's true and what's not true. But I do have a couple of questions. Does anyone know right now how long the protection from the shots will last? And is there a booster in the future?
So I'll answer that for us. So right now we have the information from the original studies that were done back in the fall and before that. So, and then remember that group is still kind of being looked at, and then we added more people, right? So we're up to 280 million people now. And so that original group, though, we're still following them to see how their immunity is going. So every time you hear the CDC come out with new guidelines, so you remember that, like at a 6-month mark, they're like, okay, we can lift some of the restrictions for vaccinated folks. So that's kind of a moving target, but so far it's showing that we have good immunity so far. So remember, it is still fairly new technology, right? So that you get more information as it comes out. What was the other question?
Is there a booster in the future?
So there is some discussion of the potential of a booster. The nice thing about this technology, it's fairly easy for them to go back and add the variants or the protection that would be needed. We have not, and you'd be upfront, we have not heard of any operational stuff that's coming out that we need to do anything quite yet. But there's always a possibility if so they're watching right now the Indian variant here in the United States. If that variant ends up being more deadly, and it does what the B117 variant has been doing, which has been growing rapidly, I would not be surprised if they add on that variant on as a booster. So we don't know yet, but won't be surprised.
Stay tuned for further.
Yes.
And I have a question. I don't know if it would be for Dr. Doyle or Dr. Graves on this one. I have heard that there's some concern about fertility issues in the future for the young children. My grandchildren run from 2 to 12 years old. Can someone address that? 2 boys and 2 girls, either one.
Yeah, so as I said before, during the trials, early trials, when pregnant women were not involved in the trials, but women were involved in the trials. And all of those individuals were followed. And so far, there is not an incidence of infertility in the actual participants of the trial. And then even now, women who have obtained a vaccine and then gone off, go off to get pregnant, we have not seen so far reported cases of infertility. But more importantly, the vaccine, and we have to emphasize this over and over again, the COVID vaccine does not alter DNA. The COVID vaccine does not enter DNA to cause any changes as far as that could, therefore, the consequence of that would be infertility. So far that has not been shown to occur, and in addition, we have many that have gone ahead and been able to get pregnant after getting the COVID vaccine.
Yes, I was thinking more like the children now who are still developing. The kids are 2, 4, 10, and 12. So like for future for them, there's no data on that?
Well, there's no data on them because we have not tried the vaccine on them. But every clinical trial that we've had thus far has not shown the pathway for infertility in young adults or in adults as far as infertility. And there's no vaccine to date that would have that same pathway that will cause infertility in children. And the way that we have developed these vaccines with mRNA or viral vector vaccines, these are old technologies. These are not new technologies. And they have been used before, and in none of these technologies has infertility in children been a consequence, or young adults.
Okay. And
all right, we got time for one more from the audience. You got one more quick one?
One more.
All right.
I know of a person who says that she will not get the vaccine because of religious reasons, because of concern that an aborted fetus was used in the development of the vaccine. I tell you what, I'm Catholic, and the priest said, get the vaccine, folks. Get the vaccine. Get what you can. Is there anything that I can say to this person?
Yeah, I mean, all I know about that is that in the original research that used to study the vaccine, there was embryos or something used at that time, but not in the development of the manufacturing of the vaccine. That's not what's being done. And so, yes, and you're right, the Pope has even said, this is not against religious laws, so get vaccinated. And I have not heard of any other religion that says you cannot get vaccinated. So we do have medical exemptions, but there's really not religious, that says you can't do this. So, but if that might help in the development, and I think it was just one of them. I have to double check, but it's not. It was just Johnson & Johnson. So you can tell them that Moderna and Pfizer, that did not happen. So come on over and get vaccinated.
All right, one more from the audience, because the fees really jump in the second hour.
Okay, we have one more over here.
They're like fees?
Fees? Oh, no.
Oh, yeah. Just a fast question concerning pediatrics. The various papers I've seen show that in kids of kindergarten age and elementary school, there's very little transmittivity and very little infectivity of the virus. I see here a paper done in Germany and published by the various organization, pediatric organization, saying, recommending opening school without mask and all that. I know many people who have young children in school have expressed frustration at their kids having to wear masks, and we'd like to know your thoughts about that.
You can do some of that too. So I would say that originally in the early stages of the pandemic, there was a lot of thought that the children in the elementary school ages weren't at that much of a risk and that transmittable. But as like every other aspect of COVID, as the days and weeks have gone on, we've learned more and more about the disease. And there is evidence that shows that, one, children do get it in those age groups, and they can transmit it fairly well. Which just kind of is intuitive, makes some sense, because elementary school kids are really good at transmitting viruses for various reasons. And we have seen some evidence, and I'm sure we'll discuss in a second, but there is evidence that even in schools, as you decrease the measures we take to prevent transmission, such as masks and distancing and cleaning and things like that, that transmission rates do go up. So, but I will also say that in my practice, I have diagnosed many children in the elementary school age with COVID. So it does happen, and they do get it, and they do get it from each other. So the risk is there, and I would say, again, for the older 12-year-olds and above, get vaccinated now, and when the vaccine becomes available for the elementary school kids, they should get vaccinated.
So I'm going to tell you from our own experience here in the health department, and we work very closely with our school systems. We've had two studies that have come out of Georgia with the CDC. If you go to MMWR, one recently just came out. And so what they showed was if you were able to do the prevention, which is to socially distance and wash your hands, ventilation, and wear your mask, you were in a much better situation. When you give up the mask and the ventilation, the number of cases skyrockets. And so that we know that to be the case. So it's difficult to compare Germany to what's happening here. Social distancing was very difficult, and I have to tell you, I was very grateful that they required masks, because that's all they had at one point. Only thing they had to fight against COVID was masks. And so what we saw here also is transmission amongst students, because they were wearing masks most of the time. It wasn't as bad when they were wearing their masks, but if you had a teacher involved, the rate of transmission skyrocketed. And now I've already told you, so our rate of vaccination is just above 30%. So that leaves over 50%, and I imagine teachers too that are not vaccinated. So we're talking about putting in, these kids are in there tight like sardines, they are unvaccinated, and many of their teachers are not vaccinated. We've had at least 3 teachers die already from COVID-19, and so now if you have everybody together passing it along, I mean, a variant is going to come out of that, So I hope that we do continue doing some prevention, because if you can't get vaccinated, you don't have anything else. So,
Dr. Hine?
We also have some experience in this country. Many of us are aware of the recent spike that happened in the state of Michigan that happened in schools. I'm sorry. I'm so sorry. I thought I was loud enough being from New York. We do have, my comment was, we do have some experience in the United States, because many of us are aware of that spike that happened in Michigan a few weeks ago, and it started in schools. And it was, and I'm sure my pediatric colleague can talk more convincingly about that, but it was very concerning, because that was a group of school-age children who weren't wearing masks, who weren't distancing, and you saw a spike in infections, and it was a very concerning spike for a while. So we do have some experience in the United States. Dr. Memark is being very humble. She was author on one of those papers about how mitigation strategies of masking and distancing in the state of Georgia can work. Yes, sir.
All right, we've been an hour. I'd like to thank the Wellstar Health System for sending us the firm of Hines, Doyle, and Graves here this evening. Very informative. Dr. Memark, Director of Cobb and Douglas Public Health, the video with you and I will be coming out soon. Please stay tuned for that. The folks with CORE, they've been next door here, vaccinating folks here at the Jim R. Miller Conference Center throughout our time here. Thank them as well. And Cobb County Board of Commissioners Chairwoman Lisa Cupid for organizing this event. It was very informative. We'll have it on our YouTube page for everybody to partake in. These folks aren't going anywhere for those that are in here, but for everybody else, thanks for tuning in and good night.